A very good afternoon to all of you and welcome to the GMOA Academic Cow program. So today's lecture is on a very important topic, which is key concepts of stress management and work-life balance. So we have invited Dr. Lasantha Wijesekara, who is a medical doctor and an academic and a senior lecturer in psychology. He is holding an MSc in applied psychology and currently reading for his PhD in psychology. His areas of expertise are learning disability of children, couple and relationship counseling, and wellness coaching. He has contributed as master trainer in counseling, communication, parenting, and stress management skills for public health staff and is currently attached to the Family Health Bureau of Ministry of Health. And good afternoon, Dr. Lasantha, and welcome to the program. Over to you.
Thank you, Dr. Charvi, for the kind introduction, and thanking GMOA for giving this opportunity to share my knowledge and experience in stress management. I would like to start with some memories in my internship where there was some days we are laden with enormous stress in the evening and we don't know how to deal with that, right? As medical professionals, we have to face some extra stresses compared to the general public. In one literature, when I do some literature survey, I have found in one paper like how many reasons that we can see in addition to the general public, doctors will face stresses in their professional and personal life. Some good examples are like when they are facing patients who are having trouble in their life, and sometimes losses or worsening of conditions you have to experience. With all those, doctors are facing negative emotions throughout their life and day in, day out, and that is becoming their normal experience. In addition to that, facing uncertainty and dealing with updating knowledge in medical practices, and sometimes when patients come to the doctors, they have some knowledge and doctors have to get updated, and otherwise that can be a stress problem. So it is not just the clinical practice. Some situations that face doctors during their professional life are stressful. So as I continue as a medical officer, I have found this parallel path in psychology where I have identified that there are like very successful interventions that we can adapt into our lives to control stress. So that secret I am going to share with you. So we'll see how to stay strong under pressure when stress is there. Stress is inevitable for us and it is going to be very significant compared to general public. Now we'll see how, as medical practitioners or physicians, how we are going to deal with it. Today I am focusing on areas like normal stress cycle, because that will give us some underpinning to our knowledge, how we think about chronic stress later. Then how stress is appeared in biological perspectives and psychological perspectives, and then we'll understand what is chronic stress, and then stress management strategies, and how relaxation and sleep, which is very common interventions and very easy interventions that we can adapt, can help us. First of all, we all know what is stress is. That is changes in our equilibrium that is happening in time or place where we don't have enough control. These changes can be due to external stressors. So the stressor is the initiating point that starts stress cycle. Then based on the stressor, we are having some response in the mean of body's reaction, which is internal. So when external trigger is happening, body reacts to it. Most of it is involuntary, we can't control it, and according to the various theories, sometimes it has some component which is voluntary as well. So stress is not a devil, it is a very protective experience which really safeguard our lives in difficult situations. So it is not a bad thing. So it is very normal and it is really necessary. So this is the stress cycle. We will start from the upper circle, relaxed state. This is the state we are there in most of our lives when we are in a relaxed state or in a place where we are really feeling not engaged with a lot of work. So if I give an example, after a meal you are like looking at nature without having any list of agendas in your calendar. So that day may be a relaxed day where you are thinking about your what is happening out there right now. But it is not the case when come to the usual life, because we are exposed to stressors. That is the second circle. Stressors can be in the original stress cycle, it is predator prey is the stressor. Either predator to prey is the stress, or prey is the predator to stress. So stressor is very simple predator prey requirement, but in modern life it has been redefined a lot. So because of the exposure to the stressor, stress response happens. Stress response, sometimes we explain it as fight or flight response. That means when there's a stressor, either you will to go away from that place, that is flight, either you will fight for you to get protected from the stressor, that is fight. And there are some other explanations like freeze as well, where like people identified in certain situations we react without even moving or not reacting, which can be freeze. So it's fight, flight, fight or freeze. When this response is occurring, you are basically given the best opportunity for you to get rid of the stressor. And when the stressor is gone, we come to a state when we realize that stressor is gone. We come to the state, this fourth circle, the recovery. So you start recovering. So you are going back to the relaxed state after the recovery. So this is the normal stress cycle, and we are like when there's a frightening or significant change in your environment happens, this stress cycle activates, and it is part of modification or adjustment that happen to that environment, which is quite normal. So biologically, we all know how stress response happen. We call it HPA axis, which starts from hypothalamus, sending message to pituitary, and from there adrenal gland, which releases cortisol and other stress hormones, including adrenaline. So sympathetic nervous system also activated, because of which you are getting so many changes from head to toe. Things like dilated pupils, sweating, flushed faces, and increased heart rate, and even stroke volume of the heart is increased. When come to respiratory system, rapid shallow breathing happens, uh, and your muscle tone increases, and specifically gastrointestinal system going into shutdown. So basically these changes happen in a flicker of 1 or 2 seconds, and significant changes happen. So focusing you to be able to maximally fight, flight or freeze in response to the situation. When come to the biology, we are very familiar about this, but when come to the psychological aspects, there are so many theories that explain what happened when in the body or mind when stress is happening. According to the psychologist, the theory of this Lazarus theory, it explained that when someone is exposed to stressor, there's a primary appraisal that happen, which quickly give us a viewpoint whether this is a threat, right? So our quick idea would be it is not a threat, it is something positive. It can be something positive as well, although it looks very sudden. As an example, surprise. Then it can be dangerous. That may be the quick response or quick idea we get, or it can be irrelevant. So it is not, although it looks very sudden and impactful, it is not really relevant to me. So you are taking the first interpretation about the stressor, that is the primary appraisal. Then we go to the secondary appraisal, and secondary appraisal have a little bit longer judgment about how your resources will work with this stressor. If the stressor is dangerous, you are looking at the resources, whether they are sufficient or insufficient to manage or face that stressor. So if the there are sufficient resources, we respond differently. If the resources are insufficient, we respond differently. So that is what Lazarus says. So what we see is, if there is enough resources to control the situation, we focus or we start coping in a problem focused strategies. If the resources are insufficient, we are coping to the situation with the emotion focused strategy. So that is, so we can see like it is bit different from situation to situation, from person to person. Even for the same stressor, we are responding differently, and biologically it looks like very spontaneous and there's no control, but in psychological perspectives we see as there is not, stress is not always same for all the situations. We have some control on it. So when come to our situation, in same stressful situation, sometimes one doctor will face that situation differently, while other is affected a lot. So that is because how the resources we have and how we are coping with the situation. So this normal stress cycle happens, and what is happening in the modern life is we are having something called chronic stress cycle. So you can see now there is a short circuit between stress response and stressor. So when you are wake up in the morning, from that point till you are going to bed in the night, you are having one after the other stresses are appearing and your stress response is activated. So there is no chance for you to recover and get relaxed, because your all the day is filled with stresses. Stresses can be either in your workplace, either in your family, or maybe with your kids or relatives, spouses, or whatever the people, or in the same time whatever the environments you are dealing with. So we have hundreds of thousands of stressors out there which are not serious as predator prey stressors, but when come to our day-to-day life, we have small stresses which are endless. So chronic stress happens because there are endless stresses are there, so we are continuously activating our stress response and we don't have recovery chance to become relaxed for a while. So you can see there's a little difference in the normal stress cycle and chronic stress cycle, but what we are experiencing is chronic stress cycle with lots of implications. So it is chronic stress is prolonged activation of stress response, and cortisol levels are maintained high, which result in physiological, biological, psychological, and even social adverse effects. So what are the adverse effects we have? Physical adverse effects are like stress. When stress is there, we have various physical symptoms like fatigue, headaches, heightened blood pressure, gastrointestinal issues, and even impotence. And when come to psychological, we have anxiety, depression. In long term, we can have these disorders develop. At the same time, we can be emotionally very unstable, irritable, and we feel like burnt out. Behavioral outcomes would be poor sleep, unhealthy eating, substance use as a response to as a way of stress management. Sometimes substance use may be the one coping mechanism which is common. When come to the professional life, it reduce concentration, your focus may be not that good enough to work with clients, and sometimes decisions can go wrong, and sometimes your ability to empathize with your patients will be lost. So you are also emotionally disturbed. So adverse effects of stress is something that we have to understand and we have to look at. So if you are maintaining chronic stress for a long time because of the physiological and psychological issues happening, you are having adverse effects in all these areas. So one of the main problems that we can't really see, but what is happening inside, is called brain fog. So when you are stressed, this brain fog or the cloudy effect is happening. So although the solution is very close to you, although like there are different options are available, you are also a person that have lots of strategies to face this situation. When you are under stress and you are having brain fog, you can't see the solution. It is like you want to go out of the room, you can see the door, so you can go out. But when you are stressed out, it's like your entire room is filled with smoke, so you can't see the door to go out. So you will stuck in the problem without reaching the solution. That is why when someone is stressed out, having a small chat with one of your friends or someone who will understand you give you lots of relief in the early stage, because you are basically can't understand what's happening when you are under stress. Although you are a well educated person, although you have good enough experience, although you are responsible in that situation, sometimes you will have to listen to your colleague or your relative or friend, or sometimes you will have to have a chat with the counselor, small chat with the counselor, and see what is the solution and certain activities to reduce your brain fog, so you can even take control from in your problem. So when mental fog happens, you can't concentrate much, so you will be, your mind is going here and there, and you can't really concentrate and try to solve the problem, and sometimes you can't even find the problem. You don't know what has happened, you are emotionally totally disturbed, and that is how it happens. And when come to forgetfulness and memory lapses, reduced decision making clarity, are certain negative aspects that can really influence your professional life. When come to emotional clouding, there is irritability, thinking so much negative than able to see positive things, pessimism, and poor judgment. Then it's like feel like there is mental haze, limiting efficiency and focus in your day-to-day life. So when come to when stress is happening, if you really understand, okay, now in my day-to-day life I am going through lots of stresses and what I can do, then we have identified there are problem focused mechanisms for stress management and emotion focused mechanisms for stress management. In those two categories, there are positive ways of coping and negative ways of coping. We will see how what are the positive ways of coping and strategies if we inculcate them into our day-to-day life. When come to two strategies, one is to try to reduce the stresses in your day-to-day life. If you are a person who's facing lots of stresses, try to bring it down. So you can manage your workload, right? You can keep 1 or 2 days in the week without like overloading your work. Then time management, you can manage your time, so you will be more efficient and workload will be managed efficiently. Then stopping digital overload, and then managing finances and managing relationships. So those are the ways that you can reduce the stresses from one hand. From the other hand, how to improve your recovery? I told like there's very little opportunity for us to recover from the stresses. So how to improve the recovery? So relaxation techniques. So the best message I would pass today would be have your own relaxation technique for you to get recovered, right? When come to sleep, that is the best and very comfortable way of handling your recovery, improve your recovery. So having a good sleep. So exercises can help to curb your adrenaline levels, and asking for support from your close ones or someone who can empathize your situation, and self-care. Self-care is looking after yourself, taking some time out, having me time, uh, spend some money and time for yourself to improve yourself, maybe personal development, maybe for leisure, so self-care is improved. So when you are thinking in these two strategies, what one is to reduce stresses and other is to improve recovery, your level of stress will be manageable in a positive manner. But there are like negative coping strategies as well. Sometimes because we have the brain fog and because we are not clear about the solutions and resources we have, we might be uh, selecting negative coping mechanisms. Sometimes uh, when there's excessive stress, when there's uncontrollable stress, some may go for substance use like excessive alcohol consumption or any other substance use. At the same time, eating problems are very common. Sometimes people, when they are stressed, they eat more, or sometimes they give up eating. So overeating and undereating are some negative coping mechanisms. Isolation and withdraw from social support is a negative coping mechanisms. Sometimes for a limited period of time, it's good for you to stay by yourself just to see what has happened and to reduce your emotional distress. But totally getting isolated or withdrawing from your society that you are living is not a good way of coping. So you have to proactively try to reach someone and have a discussion and see, because someone can, maybe even a child or younger person or inexperienced intern or one of your colleagues who are young can help you in a situation where you are under stress because you are not clear what's happening when you are really under stress. So if you really understand what's happening in your brain, you don't have to be worry. You don't have to worry that I can't ask from a junior. But what you can do is, whatever the possible or available support, you should be able to approach. So sometimes excessive screening time, gaming, then avoiding your work, procrastination, anger outbursts, then aggression and denying your health needs are negative ways to handle your stress. There are like so many negative ways. I have shared with you common um, negative coping mechanisms that we try to avoid if you are under stress, because negative coping mechanisms doesn't bring your basic stressor out. Stressor is still there. You are trying to cope with negative coping mechanisms, so there will be more stressors adding to your stressor list than you are removing one stressor by one with positive coping strategies. So I think it's very clear how when there's a stress accumulating, I have to identify, okay, there's brain fog, so I have to have a chat with someone, then I will have a clear view, then I have to select positive coping mechanism, and positive coping mechanism will gradually reduce your stresses. So yeah, every day you are improving in your stress level. So these are few examples of positive coping mechanisms, that exercising, mindfulness, meditation, progressive muscular relaxation, yoga, visualization, and slow deep breaths. If we take these examples, any of these are not familiar to us. Especially in our medical schools, we are not exposed to these strategies, although we are spending a hugely stressful life in our higher education. So it is our duty to actually learn these strategies, which are not very hard, they are all are very easy and the same time giving us a better outcome. So we have to gradually learn and practice one by one. So after some time it's becoming very easy for you to get relaxed when stress is out there, because you have lots of short term, intermediate and long term strategies to deal your stress level. When come to positive coping mechanisms, we have like a positive coping mechanism wheel I have shared with you, which has 4 main areas, that is personal abilities, social resources, and actions that we can do, and available options. So when we are looking at personal abilities, so what you do is you are self comforting, like you are making your life little easy by handling things. When come to social resources, you are approaching the whatever the social support available, and that will give you guidance to face your problem. When come to available options, it can be accommodation. Sometimes you will have to accept what is happening and not to overthink, and maybe you try to persuade the other stressor to manage it, things like that. Then negotiation and accommodation. Then finally actions we can do is problem solving and information seeking. So when your awareness improves about the stressor, it is very easy for you to handle it also. So there are like, these are the strategies, but when come to the actions you have to do, they are very simple. So very simple actions can bring you back to the controlled stress level. So how exercise can be helpful is because we have more cortisol and adrenaline level in our body. When we are physically active, those hormones are basically utilized for you to do those actions, and body start to understand now you are in a, you are physically active, your muscles are tense, but you are doing some purposeful activities, so the stress level goes down. So taking bath, and that may be a place where you are having a self-talk, spending that comfortable time by yourself and having a self-talk, what has happened today and is this the way I have to handle it, and in future if it happens, how I can handle it. Without focusing on your negative emotions, you can be more reflective and take a bath, which is becoming a place for you to have a very positive self-talk. Then give yourself a pep talk, right? So just be hilarious by yourself and be joyful, can bring you positive mindset for the day. When come to the meditation, it is something that everyone knows, but very rarely we do it. Meditation is one of the very effective methods that you can accommodate for stress management, especially when you are doing meditation. You are practicing something called mindfulness and current moment awareness. So you are maintaining your life in the present, then going to the past or going to the future. You are maintaining your mental state in the current moment, which has been scientifically proven that your mind would be very relaxed when you are spending time in the current moment than going to past or going to future. So meditation usually gives you guidance how to keep your mind in the current moment awareness, and there are various methods that you can um, uh, practice mindfulness during meditation. So working on managing time, that also was there. That is one of the very prominent strategies in our modern day life. At the same time, for busy medical practitioners or physicians, uh, working on time, like managing your time, is really important because it will save you lots of effort and time for you to rest as well. So what they have say is, like, if you are spending more planning time, your working time will drastically go down, right? So, if you are not spending any planning time, your working time will be very high, so your resting time is very limited. So if you are planning time, like, improve by a little, like let's say 20 minutes planning time become 1 hour, is very small change, but your working time can go down from 10 hours to 6 hours. So you are saving more hours which can be allocated to your resting time or leisure time. So you are having enough recovery time for you to recover from the stresses that you have faced during the day. Then asking for support, that I have stressed it several times. So without waiting that it will go away automatically, it's better to ask for support. It is really important. Then establishing healthy boundaries, like you can like, you can't give up your life's goals, so you will have to have healthy boundaries. So you can, without overeating or without undereating, without sleeping a lot, without getting isolated, you are continuing your life while trying positively to engage in the coping mechanisms that is suitable for you. And creating a to-do list is a very good strategy, and that is also a important point I would like to share. So killers of relaxation would be overthinking and screening time, that I wanted to really share with you, because in our experience with working with working adults, uh, one of the worst thing that they do in the stressful situations is overthinking. When you are overthinking, the what happens is you are going even further to a situation like brain fog, and then there's a situation where you even see in unrealistic things as normal when you are overthinking. So overthinking is something that we have to really manage and try to reduce. There are, like, so many psychological strategies when someone is overthinking. What sort of techniques we can use? So it is basically where you will have to get clear support from a mental health expert. When come to the killers of relaxation, other thing is very common: screening time. Screening time is everyone is now talking about this screening time, which is not good for your eyes, and at the same time it will take your brain space, which is called cognitive overload. So when your screening time is very high, your brain space filled up with lots of information which are not relevant sometimes, and sometimes which are really work against you to add more stress to your life, right? Sometimes you may be getting up very fresh because you are going through the your smartphone. You may be worried about some animal in another continent because you have seen a video. So stressors are added in addition to what you have in your collection. So screening time have multitude of influences to increase your stress level, which we can easily reduce by planning your screening time, be conscious about your screen time, and make conscious selections like reducing alerts or sounds, and having screen time breaks, and having mobile free bedtime, having mobile free meal time. So you are basically going away from the screen most of the time. Only when you are really needed, you are reaching outdoors. So building healthy stress cycle is my suggestion for you. So what will happen is you will have stresses, but because of the healthy stress cycle, you are advancing, you are becoming more successful or more advanced, although there are stresses or stressful situations out there. So take mini recovery breaks, like while you are working you can take like 1 or 2 minutes break without like talking to anyone, without looking at your phone, without planning anything, without thinking about the next patient. Just stop for a while, 1 minute, to have a mini break. When you are having this, if you can breathe deep about 3-4 times, that will also improve your recovery break. Then so you can do little things to build your resilience. So when come to sleep, sleep is one thing that you can improve very easily, because anyway we all have our bedtime during the night. Sometimes it is not adequate enough. When come to improving sleep, it has to be quantity or quality. So we'll see how quantity is improved. You can see the sleep stages diagram I have shared. So number of hours is in the it is shown here, and stages of sleep is shown here. So when we start sleeping, we are going step by step, stage 1, 2, 3, 4. So 4 is the deep sleep. So you can see when you are sleeping about 6 hours, you are going 2-3 times into this deep sleep level, and after that it is not so. So at least as an adult you have to have a 6 hours sleep, so you will have complete 3 cycles. In the same time, that is the minimum amount of time. So if you are not getting enough sleep, right, let's say you are sleeping only 5 hours every day, so take 1 or 2 days of the week to have a longer, about 8 hours, 9 hours sleep, so that will recover the depth. So sleep depth is one common finding that doctors have as a stressor. So if they, because they don't have enough sleep, their stress level go very high, sometimes without not notifying what is happening. So what will happen is, after some time you will be having a alarming situation where you will fall into sleep in environments that you are not intended to, like while you are working, while you are driving, you are falling into sleep because your sleep depth is very high. So it is very important to have a very good quantity of sleep, that is minimum 6 hours, and at least 1 or 2 days in the week having about 7 to 9 hours sleep. So if you have very packed daily routine, then maintain consistent bedtime. That is really important. So the quality of your sleep will be much more. So create a dark, cool and quiet environment for sleep, because you know when during the night there is the ideal time for you to have a sleep, because melatonin support and your body's hormone changes all happens in a circadian rhythm. So during the night body is ready to rest, and your brain is ready to rest in a while. From the other side, the brain is working hard to bring all the storage of memory that which happens in deep sleep level. So you have to give enough sleep to store what you have learned during the day. Then limit caffeine and alcohol exposure at the bedtime, which will sometimes really destroy your sleep quality. And reduce screen exposure before sleep, which is very well known, and now research has more and more proving that close to bedtime, if you are using your screen, your quality of sleep is going down in different ways. Then respect natural sleep cycles. So 79 hours is the recommendation, but it should not be less than 6 hours. So if you can improve your sleep quantity, the time you are sleeping, at the same time quality, it is very important. In addition to this, I would like to share with you the concept of power napping. If you are like really tired over the day, you have lots of work, keep your head somewhere for some time less than 20 minutes. It can be 1 minute, 5 minutes, 10 minutes, 12 minutes, whatsoever. So have a small sleep where your brain will relax while your body is not relaxing. So you get up physically strong, but your brain has a small chance to have a small rest, which is called power nap, because you feel rejuvenated after this power nap and you are okay to work 2-3 hours again. But you can't replace your night sleep with any daytime sleep. Night sleep is very important if you are losing it. If you have done night shifts, whenever you have the chance to sleep following your night shifts, try to get this 7 to 9 hours sleep, which will really recover you a lot successfully. Not 100%, but very much it is important to have a adequate long sleep during someone who is doing night shifts. So sleep management of sleep is really relevant for doctors, and you have to look after your sleep, and we can use our knowledge about our sleep cycles and improve our quantity and quality of sleep. Right, so we have discussed about mindfulness, and now you can see in this image, if your mind is full of work, you are like stressed and you don't have solutions, you are living in a overthinking and fully distracted day. But when you are mindful, you are focusing on to the current moment, what you are really seeing at this moment, you are focusing to it. Like if you are talking to a child, you are focusing to the child. If you are working with a patient, you are listening to the patient and trying to support. And if you are having your lunch, you are focusing to your lunch and having it and having the best out of your lunch. Likewise, if you are being mindful, you are focused to current moment and you will be very relaxed. But if your mind is full of so many other things, you will have lots of stress. So in mindfulness basics, what they say is stay present in the current moment and observe thoughts without judgment. Like this is a bad thought, or this is not a good one, this is a good thought. Likewise, don't label your thoughts, but just observe that what is coming across your mind, the thoughts cross your mind. Then if you have negative way of thinking, like things like this world is not helpful and there is no one to support me, there's no help to me, and I am always having negative experiences, things like that. The negative loops can come in, kick in, and your mind can be further clogged with these ideas. So it is very important when you are practicing mindfulness not to judge your thoughts, in the same time not to stuck in a negative thought loops. So you use simple techniques like mindful breathing. Like if you go to YouTube and see mindful breathing techniques, there are like lots of guidance you can find. There are like mindful practices like mindful walking, mindful breathing, mindful body scanning, and things like that. So in the mindful basics, what they say is stay in the current moment, don't judge your thoughts. If it is moving towards a negative loop, observe it and take back to current moment, so that will dissolve your negative overthinking. At the same time, to have this, there are like very simple techniques that you can use. Some things like mindful walking, mindful breathing, being mindful over the day-to-day activities, and mindful body scanning, and so on. These are not very difficult. If you practice, it become part of your life and help you to control stresses efficiently. So finally, take-home messages would be stress is not not an enemy, it is natural, and when come to the chronic stress, that is the harmful thing. So when come to biology, stress is mostly like a very automatic thing, we don't have any control. In psychology, it gives a perspective that it is not completely uncontrollable. You can modify, and from one person to other it is different. So we have discussed mainly about how to reduce stressors that make you stress and how to improve recovery. And main areas that I have thought of to make you relaxed or improve your recovery is manage your overthinking and reduce your screen time. In addition, we have gone into detail about the sleep cycle and sleep, which is really important in handling stress. So these are the main areas I wanted to share with you. And so as physicians and healers, what happened would be stress unhealed, when unhealed, weakens head, heart and hand, blurring the purpose of life for which we stand. So take your measure as physicians who are healing others without allowing weaken head, heart and hand in a physician. Manage your stress properly so you can look after yourself better. At the same time, you can look after your patients very efficiently. So hoping you will get these messages into your life. Thank you so much for listening.
Thank you very much, Dr. Lasantha Wijesekara, for that very interesting and very mind-blowing lecture. So we have a few questions to ask from you. The first question is, how does social media influence on stress?
Right. Actually, social media, we can say like we can divide into two sections where if it is relevant to your profession or your lifestyle, it has lots of positive or advantages are there. But what is really harmful is overusing and misusing. Overusing means there's a time limit that your brain can handle social media exposure, and if you are exceeding that, it become a very stressful thing. Like recent researchers have shown that if you are spending more than 1 hour in social media, which is comparatively very little amount that we are talking about, most of the adults exposing to social media far more than that. If you are exposing to social media 1 hour, your brain is basically fully occupied and you can't do any deep work. You can do like simple things, but you can't do deep work like judgment, decision making, preparing to exam, something like that, or preparation of any documents, maybe things like that. Your day to day like usual practices you will be doing subconsciously. When come to the misuse, uh, actually social media is not under your control. Social media, who's sending social media have their own agendas. So what is happening is the consumer become misused by their agenda. So they will stick to what they are looking at the content. So they can't take their decisions by themselves when they are spending time in social media. So because of that, social media becoming very increasingly harmful to children, adults, and anyone who's consuming excessive and more screening time. So my advice would be, if you can really look at your time, right? If you can have a small alarm, or there are like facilities for that. If you are exceeding 30 minutes, if there's alarm, you know that my daily dose is like reaching. Now I have to be a bit cautious. At the same time, if you are trying to have a good sleep, this is like, even I myself experience this. Don't look at the screen for about the last 1 hour before sleep, which will give you a much better sleep.
So if you talk about Facebook and Instagram, what is the relationship with fear of missing out?
Yeah.
So what is the relationship with FOMO and stress?
Yeah, like uh, as people uh, have this comparison, right? Comparison is one of the key, uh, what we call the pushes. Comparison pushes us to reach things, right? We can like walk uh, to our workplace, but when we see someone else come in a car, it pushes us to get a car because of the fear of missing out. Like you think like you are missing something that other people have. When come to the social media, you have hundreds and thousands of things that you can compare yourself and someone else's, right? it is very stressful. It is really stressful because on a given day you will have so many reasons to feel very small or inferior compared to your society because you are looking at some other people. But when come to the real life, we don't uh, we can't compare real life and life on the screen. Those are really different. Right, when you are talking to someone, you are seeing the entire body and eyes and the whatever the person's verbal, non-verbal cues. But when you are looking at the screen can focus to a part of the body, maybe eyes, maybe some part of the body. So the non-verbal cues can be exaggerated. So most of the time screens use these strategies. So you will feel like this is something I can't do. Actually you can do, because it is on the screen, you feel like you are missing out. So there are different theories that explain how uh, we are falling into a very stressful or distressful situations, thinking that we are missing out something which is actually not the truth.
So finally, when should someone seek professional help for their stress management?
Yeah. So what I would say, like you can remember it's like as wife, right? Wife means your work and your individual life, family life, and your environment. So if you have one or many of these places having trouble and you can't manage things, as an example, you go to work and you can't focus to your work, your work become like delayed and you are not efficient enough and so on, you like others are complaining that you are not working, so in your workplace there's a problem. Then in individual life you are not getting enough sleep and you can't focus, you have headaches, body aches, there are complaints. Then in your family life, others are complaining that you are not talking, you are isolated, you are not contributing. So those are complaints that can be happen in your family life, immediate family, maybe relatives, someone else, maybe friends as well. Then the environment is community. I seen that you are very abnormal, not like before, or you have changed your habits in your environment. So these areas are having deviations from normal, what was normal for you and what is normal for your cultural society. If you are deviating from that, that means that is the broad thing. So even as a doctor you see someone is having this problem, this may be the place where you can have to decide when to take a help from some mental health expert. And if it is for doctors, it is really necessary, because what they say is like, because you are confident that you can control, you are waiting till you are failing. So wait to fail is not a good strategy. uh, Prevention is much better than waiting to fail.
Once again, I would like to thank Dr. Lasantha Wijesekara for that very interesting lecture, and I hope you will be joining us again with another interesting lecture, and see you in 2 weeks' time. Thank you.